Oh, oh man. Ouch. Escalator altercations, restroom rivalries, and hook, line, and sinker. In honor of the new MI7 movie coming out today, we are breaking down and reacting to all of the heart-pounding medical scenes and combative injuries from the Mission Impossible films. Let's make like Ethan Hunt and dive right in. Oh, kidney punch, that's what everybody says, right? Why does it hurt on that side? So your kidneys are a retroperitoneal organ, so they're sit back on that back side. They're protected by the ribs, but it can radiate pain to that area when you hit on the outside there. A lot of punching. Typically when people get punched, they get dizzy. I get dizzy! They feel like they're gonna maybe pass out. The balance is off, and it just all has to do with the fact that your brain is literally sloshing around in your skull. Oh. So, chokehold. There are a couple different reasons why somebody would maybe pass out due to these things, and it has to do with, one, decreased oxygen if you're compressing the trachea enough versus compressing the major blood vessels at the side of the neck. Oh, what? Come on. Ouch. Whiplash type injuries where you're holding on, and then your body flexes and moves forward, so your body actually tries to protect itself. In a day or two, you're gonna have some whiplash discomfort, meaning headache, neck discomfort, soreness. Oh gosh. What are they just taking a foot to somebody's head? Broken nose. Your nose! You can fracture somebody's skull in the front if you have enough force. And then the issue ends up being too is if you start bleeding, which is not, then in this position, it's gonna go into your airway if it's in the posterior aspect of your nose. And then obviously you can get blood that goes into the eyes itself. Oh, oh man. Ouch. Taking this hook right to the forehead. It's a blunt end, right? So it just depends on how much trauma. If there's a significant amount of force, that trauma can penetrate through the skull and right into the frontal cortex there, the front part of your brain. Oh! Basically like possible fractured thumb, dislocated thumb. The base of the thumb can fracture into multiple different pieces, lots of pain. Typically treatment ends up being just splinting it. If it's going through the joint itself, it needs to be seen by the orthopedic surgeon. Oh my gosh, knocked into somebody's head, pass out. You basically lose consciousness because of the traumatic brain injury that occurs. They don't depict if this person has succumbed to the injury. If they didn't, they're maintaining their own airway and just sleeping. Oh, still awake and alive. Oh. Oh man. It hit right into somebody's neck. Pain, but it also can cause a laryngospasm. The vocal cords actually spasm up because there are muscles that go as a field goal or a peace sign in the throat. Oh. Oh. Okay. The biggest thing with mirrors is you always worry about glass. So the glass can go into the tissue, cause lots of lacerations, a lot of mess, pain. It's really hard to see. You can feel it. Feel it. And just do your best to try to get it out of there. Whoa. How is this individual that strong that they can just pull piping out of the wall? Oh, so big whiplash right there, and then it could potentially cause cervical spine fractures, just depending on how you land on that. Oh, now you're trying to lacerate into the neck. Look at that neck! Into the jugular vein or the carotid artery. If it's here in this part of the neck, which is zone 2, it needs to be explored surgically if you're alive when you make it to the hospital. Put compression on that area to prevent any extravasation of more blood. You're trying to save as much blood as possible. Going through a wall, increased risk of a pneumothorax, a hemothorax, fractured ribs, even just extremity injuries from putting your arms out to try to brace your fall. A single gunshot wound to the head can cause mortality. Sometimes it doesn't. I have seen where they survive and they only have minor deficits. So it just all depends on the area of the brain that actually hits. Oh, facial injury with metal can cause not just fractures, but also like significant lacerations, bruising, and swelling. Escalator injuries, those things are so dangerous.
That kid is back on the escalator again.
There's like literally spikes at the end of the stairs. We see most injuries relating to like lacerations, and they're pretty gnarly because there's like big teeth. Oh, getting hit on the ear is awful.
Hit me in the ear!
You see wrestlers or people who do MMA where they get cauliflower ears and injuries and a lot of swelling. It causes a lot of pain. Oh! Ow! Is that like an elbow to the face? Not just getting hit in the face, but you also think about the fracture of the elbow where the olecranon can snap right off. Seen lots of fractures like that. If that occurs, again, it's a joint, it needs to be fixed. You don't typically just let it be. Got hit on the lateral aspect of the knee. Different sports injuries where you can injure your medial meniscus, your medial collateral ligament, so your MCL, and then you can totally trash your ACL, just depend on which angle you get hit. Falling out of the window, they must be up in a high rise. If you fall greater than 3 times your own height, typically 15 feet, it's a major trauma. Ooh, big blunt double kick to the chest.
You kicked me in the chest.
Can cause blunt trauma, could cause a rib fracture, rib dislocation, lung contusions, which could actually lead to hypoxia and difficulty breathing. The reaction of like, wait a minute, that guy just got passed out. Hit the head, causing a concussion and causing this individual to be knocked out. Probably going to be okay, but increased risk of bleeding in the brain as well as cervical spine injury. So if EMS showed up on scene, they'll probably put somebody in a C-collar because of the hyperextension injury that could occur from having blunt trauma to your forehead. What? Come on. I mean, that's a lot of core strength to be able to do that. A lot of kicking, a lot of punching to the face. There's not a lot of blood in these scenes. There's not a lot of lacerations, spitting, that sort of thing. Not everybody's getting knocked down in one hit. People are recovering. Oh, when Tom Cruise does the double kick again, he lands directly on his back, so you increase the risk of causing a cervical spine fracture, a spinous process fracture, which are the little bumps that you see on your back. Oh man. The strangulation injury. We've spoken about strangulation issues before. Depends on how tight and for how long something is being held to where, how long does it take for an injury to occur? Those are the factors that you have to think about. Mission Impossible. I'm actually a fan of Tom Cruise. I like all of his movies, and I think he does a very good job, and he does a lot of his own stunts, so it's quite impressive. If you enjoyed it, do me a favor, binge watch this playlist right here, and as always, make sure you subscribe, turn your bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.